Conjuntivitis. What is conjunctivitis? Conjunctivitis is an inflammation of the conjunctiva, a transparent membrane that covers part of the eyeball and the inner portion of the eyelids. The conjunctiva contains small blood vessels that appear as thin red lines on the sclera wide of the eye, and that, when inflamed, give the eye a reddish appearance. Conjunctivitis usually have benign evolution that do not affect vision, but can become complicated if not treated properly. Why is it produced? There are as many types of conjunctivitis as there are factors that cause them. Infections conjunctivitis account for approximately 1/3 of a conjunctivitis and can be due to bacteria or viruses. Allergic conjunctivitis occurs when the eye are exposed to a substance to which the person is allergic, allergen, causing an inflammation of the blood vessels in the conjunctiva. The most common factors are those mites, pollen, and other substances from trees, flowers, and plants, as well as fungi and epithelial scaling of animals. Other causes can be dry wear of the use of soft contact lenses. Conjunctivitis due to irritative cause was caused by an inflammation on the eyelid margin, blepharitis, usually caused by the use of cosmetic or by contact with irritating substances present in the environment, solvents, paints, chlorine from the swimming pools, etc. The most common symptoms of conjunctivitis are redness, itching, a sensation of or worrying body or grief, swelling of the eyelids, tearing, and discharge. Complicated symptoms can be external pain when opening and closing the eyelids, photophobia, significant swelling of the eyelids, or foreign body sensation. Those affected by bacterial conjunctivitis usually have abundant and thick yellow or greenish discharge, and it is common for them to wake up with blue eyelids. In allergic conjunctivitis, itching predominates and other symptoms of nasal allergy, sneezing, obstruction and watery discharge, bronchial, asthma, or skin dermatitis can also be added. The treatment of conjunctivitis varies significantly depending on the cause that produces it. Viral conjunctivitis, as in the case of a cold, does not have specific treatment, although there are special care recommended by the ophthalmologist that can help control symptoms and prevent complications. Bacterial conjunctivitis, on the other hand, is treated with antibiotic eye drops and usually subsides in about a week. Allergic conjunctivitis usually responds well to histamine treatment, or it may go away on its own with removing the offending allergen. Symptoms can be relieved with cold compresses and, in some cases, topical corticosteroids might be prescribed to reduce inflammation. Irritant conjunctivitis is minimized by eliminating the cause and administering anti-inflammatory treatment until normality returns. How can it be prevented? The best measure is to avoid exposure to the allergen agent. When it is not possible or the appropriate measures have not been taken and any of the symptoms described appear, it is advisable to consult an ophthalmologist. In the case of infection conjunctivitis, in addition, some measures must be taken to avoid contagion. Do not share anything that has been in contact with the infected eye. Pellet causes, sheets, towels, eyeliners, etc. Wash your hands immediately if you have been in contact with someone with conjunctivitis. Do not take children with the infection to school. Clean the secretion from the eyes twice a day. Do not wear contact lenses or makeup. Some home remedies to remove conjunctivitis are bath drops of warm chamomile tea. Clean the eyelids with cotton soap in arnica tea.